I'm Daria Brezinski, and you're watching What Wise Women Want here on Charlottesville's public access television, Comcast Channel 13. We're here every week bringing you panels of women discussing topics that hopefully will help you, your family, and your community to make informed choices. Ladies, we're the majority of the population. We're 52%. And we have 85% of the purchasing power. So let's use that power to make our choices in this world for ourselves, our children, our families, and our community. If you'd like more information about any of the panelists we have, you can go to our website at www.whatwisewomenwant.com. There you'll find background information and information to be able to contact them after this program is aired. You can also go to our website and write us questions for future broadcasts because they are listed as well on the website. Today we're going to be talking about alternative and complementary medicine, and we're going to be talking about 4 different kinds of modalities. These women represent those 4 modalities. To my right is Tammy Leiner. She is a thermographer. To her right is Jody Forman, an acupuncturist. And then we have Jennifer Prax, a chiropractor, and Robin Bernhardt, a psychotherapist. Now, each one of these ladies is going to talk about their particular expertise. Robin, I want you to start by telling us something about, I know you're a psychotherapist, but I'd like to focus today on something most people know what psychotherapy is, but let's focus on one of the aspects of psychotherapy that you do, which is known most likely popularly as EMDR. What does it stand for and what is it?
Okay. EMDR is eye movement desensitization and reprocessing. And it's a different type of psychotherapy. It's based on how the brain functions, and it allows people to release traumatic memory more effectively, more rapidly than in traditional psychotherapy. And it works with the brain's natural processing.
Okay. Jennifer, you do chiropractics. Can you give us a little bit of a definition of what, I'm sure in people's minds, people think of the cracking bones. What is chiropractic?
Right. Most people do think of chiropractors as bone doctors, but really we think of ourselves as nerve doctors. The nervous system controls everything in our bodies, from the brain and the spinal cord, and all the nerves that come out of that spinal cord control every single nerve and tissue in the rest of the body. And we're able to access that power that controls everything in the body by making sure that those bones are not inhibiting the function of the nervous system.
Excellent. Wow, that was a great explanation. Okay, Jody, you do acupuncture. Acupuncture is many thousands of years older than most of these other practices that we're going to be talking about today. What is acupuncture?
Acupuncture is one aspect of a larger topic called traditional Chinese medicine or Chinese medicine. And acupuncture is the use of very fine needles to be inserted in specific parts of the body to move energy. And we deal with the same energy that all the other modalities deal with. We all just call it different things. So in Chinese medicine, it's called qi. In yoga, it's called prana. In Western society, it's called energy or vital energy. The Japanese call it ki. It's all the same thing. It's the life force. And that it's not so strange and woo-woo. We can access it with these needles. We can access it with herbs. We can access it with qigong movement. It's another part of Chinese medicine. And but acupuncture uses the needles.
Okay. And we have Tammy, who's a thermographer. Tell us a little bit. I'm sure many people have never heard of thermography. What is thermography?
Thermography is a infrared camera that visualizes heat and activity in the body, inflammation, circulation, infection, blood flow. It's a visual, it's a map of the body, and it shows different temperature ranges for different issues that might be in the body or not issues in the body. So perfect function, symmetry, temperatures that are, that visualize the activity levels.
Okay. So I have experienced just to let everybody know, I have experienced all of these modalities in one form or another. So I feel like I'm able to talk about them a little bit more deeply than most people can. So let's start with thermography. Since you're right here next to me, I did a full body thermogram.
Right.
And I was astounded. I've had x-rays before. For people who have never heard of thermography, it's kind of the equivalent of an x-ray, except that there's no x-rays going into your body, and it registers the heat in your body, which is something very different than what an x-ray does.
Correct.
I was astounded. I had an ectopic pregnancy that ruptured in my 20s, and I could still see the place where that didn't exist in my 50s in that thermography, which I thought was absolutely amazing.
Not only does thermography show activity, it shows lack of activity as well. So when the blood flow or the circulation is stagnant, it shows up as a cool pattern versus an inflammatory process like an arthritic condition or a congestive, lymphatic, something like that. It's a much different temperature range, so it's the inflammatory processes show warmer and the lack of activity show cooler. So pain can be visualized whether it is overactive or not enough active.
And so this is less harmful than an x-ray.
Right. The infrared camera, actually nothing goes into you. It simply takes a temperature picture, just as you were standing in front of a regular camera. It would take the same picture, only the images that would come on the screen would be full color, and it would be different temperatures for different activities.
Okay. So, Jody, people have heard about acupuncture for a very long time, and I'm sure the thought of needles scares the living daylights out of everybody. But tell us, I want to make sure our audience knows that it's not the same kind of needle that you see, a physician using.
Well, I just happened to bring a few needles with me. I don't know how well they'll show on the camera, but this is a selection of acupuncture needles. The thing that to be noticed here is that there's no hollow bore in the needle. They're solid needles, and therefore they can be extremely thin, whereas a needle with a hollow bore that needs to inject something into you is going to have a certain thickness.
Right.
So these are extremely thin needles, and there's no drug on the needle. It's just simply stainless steel, and it's not without sensation, but it doesn't feel like a hypodermic needle, because what really hurts when you get a shot is when they push the plunger and they put the serum into your muscle.
Right.
That's what hurts.
Right.
Really not the needle going in.
Right. Okay. So where do you put the needles? You were talking about energy. So the Chinese say that the body has, or the Orientals I should say more specifically, that the body has what's called meridians. What is a meridian? Tell us about that.
Well, the picture that many people have seen of the meridian pathways on the models would be as if you were looking at the interstate highway system in the United States. Okay, it's just the big roads. So the interstate highway system doesn't tell you anything about the state roads or the country roads or the back alleys or anything like that. Well, the body's the same kind of way. You've got a bazillion pathways. So there's 12 major interstate highway pathways. And off of those are certain nubs where there's actually low electrical resistance, as it's been measured over time. The most powerful points, the points that get the best reactions, are from the elbows to the fingertips and from the knees to the toes. That's where the energy it comes more to the surface and is most accessible that way. And the way I practice is I use most of the points are there. I use some torso points, but not very many, because I can get much more reaction with those points.
Interesting. Mm-hmm. Okay. Jennifer, my personal experience with chiropractics is that for me, I don't know if this is true or not, but what it did for me is it reminded my body how it was supposed to stand or be, or kind of be on my feet. Is that an accurate kind of? I mean, that's what it felt like to me. It kept reminding my body the way I'm supposed to be standing or sitting rather than the way I was, bending over and things like that. Is there a body memory involved in this?
That's interesting that you should say that, because a lot of times we don't realize that we're out of alignment until we are in alignment. So people will say, oh my gosh, I feel so different, or I feel so tall now, and they can breathe better, their posture is open. So when trauma happens, whether it's just from posture or repetitive disorders or an injury or chemical stress or emotional stress, that can all change the posture and how we hold our bodies, or where that memory is, like you're saying. And when you get that alignment, things just open up and are able to release, and people feel that sensation and that energy being released, like Jody was saying. And that is a way of opening up that nervous system so that those channels are able to send messages to the rest of the body and back, communicate back to the brain. So we feel different in space when we get in alignment in our spine.
Well, I often wonder, after having had this experience with chiropractics, watching people walk, who are bent over or scrunched over the computer, or, it seems to me that, a lot of these problems that people have to do with your posture, because here you are, kind of scrunching your lungs, your diaphragm, and you're trying to eat at the computer, and nothing is really working.
Exactly. So all the nerves, like I was saying initially, the nerves travel down that spinal cord, and they're servicing all these organs and tissues. So we often see in severe scoliosis, for example, if somebody has severe scoliosis, those nerves that come out, and also structurally, they're being compressed, and those organs are being compromised. So that is an example with, a severe example of how the organs can't function normally because of that compression or because of that decrease in nerve flow to those organs. So yeah, you see people are hunched over, and then they're not breathing deeply, they're having shallow breath, which affects the oxygenation to their brain, which affects how they feel and their energy and their sleep and their cognitive function. All those things are factors, and I see that in children. They're carrying backpacks and they're being hunched over, or they're working on their little iPods or their tablets, and they're hunched over in this posture, and the children are tired, or they're having respiratory issues, or they're getting chronic upper respiratory infections, or their brain isn't getting enough oxygen because they're collapsed and they're not doing as well in school. So these are all things that connect to, like you said, posture and how we hold our bodies.
Okay. Robin, I heard that, and I don't know if this is true or not, so correct me if I'm wrong, I heard that EMDR may have been developed for soldiers who were suffering from PTSD. Is that true, and how does that work?
Well, it was originally developed by Francine Shapiro, and she had just been diagnosed with cancer. She was trying to figure out what her plan would be. And she was taking a walk in the park and in real distress, and she noticed that as she was moving in a bilateral fashion and her eyes were going back and forth, her anxiety dissipated. She was a journalist at the time, and it was so impressive to her that she actually went back to school, got a PhD, and did her dissertation on developing EMDR. So what she discovered was that the bilateral stimulation through the body to the brain calms the brain. When the brain is activated, as in war trauma or any kind of trauma, the brain shuts down its communication from the deep limbic system to the frontal lobes. When the frontal lobes shut down, it's very difficult to process information. It's like the memory stops in its tracks. And so what the calming and the bilateral stimulation does is it allows the brain to follow through and completely process the disturbance. Memory is initially brought in through all of the senses, and it has to come up through the deep part of the brain, and it is then sent to the different association centers. In trauma, that cannot happen, and the memory is almost like it's a repetitive recording that skips and stops. And the EMDR really allows that to be brought to the frontal lobes because the brain is calm enough to keep the blood flow to the frontal lobes. Whenever we go into fight-flight, we shut down activity in the frontal lobes, and so we can't really make sense of what has just happened.
Well, with all the trauma now we have news that magnifies everything, and we hear things from all over. Trauma is everywhere in our culture, whether it's pedophilia or people coming back from war or abuse in some form or another, whether it's domestic or child abuse or whatever. I mean, it seems that, we have a pervasive culture of trauma. And so is this a good, by the way, let's get to the nitty gritty of it, because we're kind of talking in circles here, but tell people how unfortunately we don't have one of the machines, but what is it that a person does when they sit down to do EMDR?
Well, what we do...
What does it look like?
What's it look like? Well, it can look like a variety of things. There used to be a light. Before the light, we actually moved our fingers back and forth in front of people's eyes so that their eyes would pass through the center of their body. People can, in groups, when there's been an enormous trauma, people will come in a group together, hundreds of people, and they will work on their emotional trauma and they will stimulate themselves. Oh. We also now have pulsars that people can hold on to, and the pulsars vibrate in your hands back and forth. And it really serves to settle down that deep limbic system so that the brain can do what it's designed to do, is to release the information, allow you to make sense of it, and then it's transformed from a somatic sensory memory to language. And when that happens, there's no disturbance anymore in the body.
So in other words, the person remembers the trauma through whatever it is that they do, whether it's the eye going back and forth or the hand going back and forth, and then they're able to verbalize and talk about it where they haven't been before. Is that what you're saying?
Yeah, it almost naturally unfolds. It's one of the reasons I really like the two modalities that I've picked, the neurofeedback and the EMDR, is that the therapist is just a supportive part of the process. We follow the brain's unwinding of its own memory. And that's what EMDR allows you to do. The brain just simply will spill out the memory that needs to be processed for the person.
Okay, so we kind of get an idea now of all your various different modalities, and we're calling this alternative and complementary medicine. So how does what you do, and chime in and jump in whoever, how does this complement the traditional medicine that medical doctors do in the at the hospitals and in their practices and things like that? And obviously this doesn't sound like a lot of hocus pocus. It sounds like there's a lot of training that goes into it and research and things of that nature. So how does this complement alternative medicine? Anybody want to start?
One of the things that I've noticed with my profession is that acupuncture addresses something that Western medicine really is not great at. Western scientific medicine is really good at trauma, at acute situations, emergencies, serious illnesses like cancers, which are really, you have to marshal all your forces. But they're not so great at chronic situations, osteoarthritis, things like that go on for a long period of time. Western medicine is much better with heroics, and they're quite heroic at it. So some of these other approaches, including Chinese medicine, are really address chronic conditions in a much more efficient way, help people be more comfortable through the process of a long-term situation.
Okay. Ladies, anybody else?
I would like to chime in. As far as what I do, one of the major screenings that I do are breast thermography screenings. And because the breasts are so taboo to the medical society, it's a different type of visual than the traditional mammogram, ultrasound, and MRI, as they all look for mass. They're all of those diagnostics are looking for the visual mass in the body. Where thermography isn't looking for the mass, it's looking for heat, activity, and blood flow. So what I tell my clients is that it's important to have all of the information on the table prior to making or jumping into a decision, and to get more information and do some homework, about their own bodies and give them some better tools to work with.
Make informed choices.
Absolutely.
So what you're saying to your clients is to do both the X-ray and the thermogram.
Correct. As I'm not a physician, and I can't tell my clients to do or not do anything. It's free will what they do. However, what I like to tell them is that what I do is it is non-radiative, it is non-compressive, it is not harmful to the body. So some women choose to do it as their main breast diagnostic, and then do mammograms, ultrasounds, MRIs, occasionally, versus the more expensive and more different types of modalities that are out there. So the informed choice is the best choice, in my opinion, for every person out there.
Is there a side effect to a thermogram?
There is no side effect.
Okay. Do you read them, by the way? Do you read the results?
Personally, I'm not a physician, so what my company does is I'm a technician. So
Okay.
I take the images, I submit them through a secured website to a medical physician for an interpretation, and they, in turn, interpret it, send it back, and I send it to the client.
Much like an X-ray technician or a
Correct,
mammogram
yeah. And I work real well with chiropractic and acupuncture, as it's a visual for them for treatment and care for pain patterns or arthritic situations. And I can't wait to work with you.
Ladies, how about you in terms of your, complementing, traditional medicine?
I just want to say that physicians that are in this community, there's a lot of very progressive physicians in this community,
Yes.
which I really appreciate. And these doctors want their patients to succeed. They want them to overcome chronic conditions that they do have a challenge with, like Jody said. For example, I specialize in pediatrics. I get referrals for children who've had ear infections again and again and again, and being treated with antibiotics, and they're not getting well, and the infections keep coming back. And the parents are like, this isn't working. And the doctor's saying, this isn't working. What else can we do? So they will refer to me to check them. And the nervous system, if it's inhibiting that eustachian tube and that eustachian tube is staying constricted, fluid is not going to be able to pass through there. And there isn't motion in the cranial bones allowing drainage. That's a nice environment for microorganisms to live over and over again. And antibiotics can maybe wipe it out once, but then it's just going to come back. So I think, to be complementary is to have another option for their patients to stop that round over and over again, which of course these antibiotics are compromising their gut, which we know there's the brain-gut connection, and that affects their immune system and sets them up for other chronic conditions again and again throughout their childhood and into adulthood. So complementary is, they have a place where they can send their patients that aren't able to respond positively to their treatment protocols in medicine. Okay. I mean, medicine, the Journal of American Medical Association put out an article, and I think it was in 2001, that indicated themselves as as medicine, as the fourth leading cause of death in the United States.
Wow.
Yeah. And this is medicine being prescribed by label, not off label, for the proper diagnosis that it's being indicated for and the right dosage to the patient that's supposed to be receiving it. That's 104,000 deaths per year.
Wow.
That's equivalent to a jumbo jet going down every other day for an entire year.
Wow.
I mean, if chiropractors were killing that many people, we wouldn't be around.
Exactly.
And we're not killing people. So medicine does have a challenge in that there are risks associated with medications.
Right.
I had a child that was referred who had fluid behind the ear. Both of her ears, she's 8 years old, and she was not able to hear. So she wasn't able to hear in class, so she was having problems with learning. And so then she was having behavioral issues. So they put her on psychotropic medications. Mm-hmm. So here's a child that could have been helped just by getting craniosacral therapy or chiropractic, by allowing those eustachian tubes to be able to release and open up those channels, and this child wouldn't have gone through these steps of frustration, not being heard, not knowing what's going on, and then feeling anxious, and then misbehaving in class. So what that can save a child, if more doctors understood across the nation and in our own community what the value is of at least just trying it out, get an opinion, get a consultation. And certainly there's circumstances where I need to refer back to the physicians, and so we work in a complementary way.
And that's exactly the way it should work.
Mm-hmm.
Yeah. Robin, the same holds for you?
Well, I love working with other professionals. I mean, that helps me tremendously. And I think it's the way I look at people. And someone who is practicing EMDR has all of the same training as a traditional psychotherapist. And we, I think, use the most important or the best of psychoanalytic, sensory motor, somatic type therapies, cognitive behavioral therapy. It's all part of what we have to know already. But what's different is the way we see people. We don't need to diagnose people. It's helpful if you can, but it's not necessary, because what we're asking is, what is it that you'd like to change? And what are the emotional issues that are troublesome to you? And that's all we need to know. And that's, to me, that's just a tremendous advantage. People feel healthy. It's a positive way of looking at a problem. It's not a diagnosis, which tends to make people feel labeled. The outcome is also what's really different. I did work as a traditional psychotherapist for many years before I learned EMDR. And one of the shortcomings was people could easily be re-traumatized, because in traditional psychotherapy, I think it's almost impossible to reach deep into the brain and release the core of the problem. Because what we're looking at is memory that's filed away in the hippocampus. That's a deep part of the brain structure. And so it's like taking that memory and putting it in a file and into a file drawer, and you don't need to deal with it anymore unless you choose to go into the file drawer and pull that memory back out. It's really not a problem. If you're re-traumatized with traditional psychotherapy, all of that memory that's still stuck in the body is immediately activated. And it's almost like going back to square one.
Wow. You know, years ago I had EMDR with Robin, many years ago. And it was about a trauma that I'd had as a child that I'd spent years in therapy understanding, but it would still had charge for me. It still had this electrical feeling to me, and I could get activated by it immediately upon thought about it. And I went through a couple of sessions. I think it wasn't very long.
2, 3 maybe.
Yeah, and after that the charge was over. You know, it didn't change the material. It didn't change the fact of what happened. But it certainly changed. Like you said, it was in a file, got in a file drawer. I didn't have to take the file out anymore. It wasn't free floating and sort of there. So I tell everybody about EMDR. It's fabulous.
Well, Robin brought up 2 points here, which were 2 of the things that I want to talk about, which is a lot of what traditional medicine does is re-traumatize and labels and defines illness. Those are kind of the 2 things that it does. Now, before we really get into this deeply, I just want to tell our audience that you are watching What Wise Women Want. I'm Daria Brezinski, and you're watching Charlottesville Public Access Television, Comcast Channel 13. And today we're talking about alternative and complementary medicine. And the specific topics we're talking about today are thermography, acupuncture, chiropractics, and specifically EMDR, rapid eye movement therapy. And we hope you'll are interested in these types of topics. And if you want to learn more about what we talk about, you're welcome to go to our website, www.whatwisewomenwant.com, and you can find information about all of our panelists, their background and contact information, or you can contact us through the website. So let's get back to talking about traditional medicine. Well, it's not really traditional, I should say allopathic medicine, the modern Western medicine. How's that, for lack of a better way to say it? And, one of the things is that, people don't come up into you specifically and say, I've got cancer, I've got this, I've got that. But rather you look at, how do you look at it? Do you look at the whole body? Do you look at the symptoms? What is it that you do when people come into you? I mean, how does this work? Because I know, in Western medicine, I've got this test and this test and this test and this test, and I come in and I've got all these exams, and now somebody's labeled exactly what I have, which may or may not be true, but they've labeled what I have. Is that the way it works, in terms of all your modalities?
Mine's easy. Mine's a visual. Mine is a visual temperature pattern that is asymmetrical. If there's an issue going on, generally the left side and the right side don't look the same. So the pattern could be an inflammatory process, or it could be a lack of blood flow process as well, depending on what the client's issues and pain problems or anything that's going on in the body. So mine's a color visual. So for me, it's pretty easy to, kind of visualize. Plus the physician does the interpretation. And so you can kind of pinpoint what only could be addressed, but not only that, but what's working right as well.
Okay, so it's not about defining what it is that's wrong, but it's looking at the inner workings of the body
Correct.
to see what's happening, in terms of circulation or whatever. Ladies, how about you, defining an illness?
In Chinese medicine, we look at patterns of imbalance. What's out of balance here? Because the theory is that the body or the universe argues for balance. Just as the Tai Chi symbol shows a perfect balance. That's that yin-yang symbol. So the whole interview process is based on symptoms and also based on looking at the pulse, feeling the pulses and looking at the tongue, and putting together an idea of what's out of balance here based on Chinese principles. Most of the Chinese principles, pathological ideas, are expressed in terms of the natural world. So a person can have too much cold, too much heat, too much dampness, too much dryness, stagnation, or any combination of those. And it can be centered in a part of the body, it can be free-floating, it can be lots of different places. And so we make decisions on how to proceed based on where the imbalance is, and then trying to bring the body back into balance.
So do you use, I know that some acupuncturists use the elements, earth, air, fire, water. Then there's the meridians, or the liver, the gallbladder, the stomach. Do they all relate to the organs in the body that they call them this? Or?
Well, that's a little tricky. You can imagine a medicine that's 3,000 years old and has underpinnings of an oral tradition.
Right.
It's going to have a tremendous variation across continents in Asia. Okay, so Chinese medicine doesn't look the same as Japanese medicine, doesn't look the same as Korean medicine, doesn't look the same as Vietnamese medicine. And then the French came in the 14th century and changed a lot of things up and brought things to the West, so there's even more variation there. So what you have now is basically two approaches in the United States. One is called traditional Chinese medicine, which is the medicine that's taught in China now. It's post-communist medicine. And when the communists came in, they kind of stripped all of the metaphysical things out of it. So it's pretty cut and dry kind of thing. You have to also, though, embrace the idea of energy, qi, the vital qi. But once you get past that, it's pretty logical. Then there's five-element medicine, which incorporates Japanese approaches, incorporates the French approach, incorporates J.R. Worsley's approach, who was this Britisher who really sort of wrote the book on five-element acupuncture. So you have usually one of the other in the United States. There's a five-element school in Maryland, so we've got a lot of five-element practitioners in this part of the world. I'm a traditional Chinese medical practitioner because I went to school in Oregon.
Okay. So again, ladies, do people come to you defined with some ailment in order for you to look at them and be able to help them, or do you assist them with their symptoms, or how does it work, and how is it the same or different than Western medicine?
I'll go. For me, people typically come to me after they've tried a lot of other things and they haven't worked. And so I want to find out what they felt good about, what didn't work for them. And I ask sort of the typical questions about their history and what the problem is, but mostly I'm just looking at the emotional distress. What are the 10 most painful memories that still create disturbance in your body? And then we help the person to identify the worst image that's associated with that memory, the most disturbing bodily sensations that are associated with the memory, and the negative cognition. What have they been saying to themselves that's negative about their experience? And then we use the bilateral stimulation to help release that. And so we don't need to have a diagnosis. It's just not necessary. And I use, in addition to that, to support the process, when we do a neurofeedback assessment, which I use in conjunction with the EMDR, We actually do place an electrode cap on the person's brain, and we measure their brain waves, and we're doing very much like what you're saying. We're looking for the balance. We're looking for where the brain is over-functioning and under-functioning. And then we are able to rebalance the brain waves, which then reduces the symptoms, because it's the brain slipping off of its natural homeostasis, which produces symptoms in the body. And so we basically train brain waves so that the symptoms evaporate and you don't have to do psychotherapy.
Excellent. So tell people what neurofeedback is, because they may not know. I mean, we've heard that word thrown around for many years. What's neurofeedback? Neurofeedback
is biofeedback for brain waves. So essentially, it is feeding back the brain's information. As the brain is doing work, it gives off energy. We measure that energy, and we send that information back to the brain. The brain becomes conscious of itself. The person doesn't have to know what's happening. The brain learns to rebalance itself and learns to hold the new pattern. So it's essentially biofeedback for brain waves.
Did you want to get into the defining the illness, or?
I can share in what we do in chiropractic, and we often get people coming to us with diagnosis, but typically it's coming to us with symptoms or long after they've tried many other things for their family or themselves. We do a neurological assessment, and we're looking for the same thing. We're looking, whether it's an orthopedic or a neurological evaluation, we are looking for symmetry and function in the body. We're looking for balance. We're looking for, is the body able to take in messages from all its senses for the nervous system? Is it sending it to the brain, and is the brain able to respond and do what it's supposed to do with the body? So whether it's doing balance, it's checking for ataxia, it's looking at how the eye motion is moving together. We're also looking for brain imbalances, which is really cool to know more about what you're doing, because it's very integrative. And for me, when I'm holding a baby, I'm feeling for asymmetries. I'm feeling for where are things stuck, where's the energy stuck, and I can feel it just release. I mean, it's an amazing thing to feel a body go from tension in a C curve and the fists tight like that to just being relaxed. When I get babies that are inconsolably crying. So my evaluation with babies is much different than a typical adult who comes in with low back pain and sciatica, which we can also use X-ray, of course, to visualize what's happening on the inside and look at degeneration and decreased discs and that sort of thing, disc space. So those are all factors, of course, in how we can approach how we help them. So we do different levels of chiropractic adjustments and other therapies in our office to address.
Well, we keep throwing around this term balance, and I think it's like this thing out there in the sky called balance. And one of the things I've talked about on earlier programs is that for me, balance is like an airplane. An airplane doesn't go straight through the air. It keeps on going like this in order to maintain itself in the air. And thankfully now it does itself automatically with computers, and it's not the pilot who's constantly trying to keep it, right and straight. And so why is it important to keep, what does balance look like? I mean, we're all unique kinds of human beings, and, stress makes us go one way or the other, and I'll bet any money people don't even realize that when they're on the computer with their right hand on the mouse, that their body is turning this way and that to compensate, or overcompensate. And you get used to that out of balance feeling, of having the body be twisted. And I can always remember going into the chiropractor and him telling me one of my legs was a half inch shorter than the other. And I'm like, so what does that mean, But what happens is, then the body overcompensates for it. And the minute he realigned me and my two legs were straight again and I stood up, I went, wow, this is what it feels like to stand upright. I don't know what that feels like. So how can we, for example, somebody with a broken coccyx bone, they're never going to have that bone put back into, that bone is never going to go back into place. Or somebody who's had an organ removed, or things of that nature, if those are what keep our body in balance, then what happens? How do you keep in balance when those things are missing from the body, so to speak?
The body has an amazing ability to heal itself. Mm-hmm. Yeah. I mean, we are adapting beings, and we oftentimes will grow something new. We'll grow a new organ, for example. I mean, we've all heard about the vasectomy babies. So new pathways are created. We have a surprise, delightful fourth child. So the body will adapt and it will figure out how it needs to work. Just like we know with the brain, we have neuroplasticity. We've seen, there's documentaries on people who've lost function of half of their brain, and they create those functions and move them to the other side of their brain to function for the way the right side of the brain is supposed to be working. I mean, the body is amazing. If you give it the activation, you challenge it to rise to the occasion, it will do it with the proper support. And that's what these modalities all sound like they're doing, is helping the body to heal itself from the inside out by giving it the support, removing the interference, helping to remove those imbalances, or bringing it to the body's awareness and to the brain's awareness that we are out of balance. I mean, that is normal, like you say, to go off balance, but we are designed to come back into symmetry and into balance. And our bodies will do what it needs to do as long as we do have those proper supports.
Think about a woman who just, comes out of a, say like a massage or something like that, how wonderful she feels. It's that moment where you go, this is how I'm supposed to feel. And that's kind of an incredible thing after, chaos with family and everything in their mind. I find also with when I do pictures, sometimes it only takes a picture to make a change. Sometimes they're saying it's, there's nothing I can do about it, and it's something I've had my whole life, and then they see a picture and they don't like what they see. And sometimes it just takes a little visual to make a big change.
I think we all want to be happy. And it's not just happy on like, I'm going to wake up today and I want to be happy. It's on a really deep level. And when folks seek out our services and the services of other non-traditional, non-Western scientific, and even Western scientific medicine, they're coming because there's something that they want to change so they can be happier in their lives. So often people come to us because they've exhausted other avenues, and so, okay, I'm finally here. But at other times too, they think, well, I read about this on the internet, or, I'm trying to have a baby and I saw on the internet that I do acupuncture, it helps with the IVF I may be doing over here, and can you, so we want to move towards being happy in our lives, being happy, in our bodies, and all that. So that's why I think they use all of us for those reasons.
I look at it as optimal function. People want to feel, it's sort of a smooth feeling when all of the systems are working together. It feels good. When we're under stress and people come in and they're either really anxious or really angry, you can see it in their heart patterns and you can see it in the brain waves. The brain waves look very agitated, and that's exactly how people feel. When we do neurofeedback with someone, they go out of our office feeling like they've had a massage, oftentimes, because everything is smoothed out, and that's the word that people will say, they feel smooth. But that's because we've gotten rid of the interference. We've gotten rid of the stress in the system that produces almost like static or a kind of irritating feedback that's not helpful. Once that's gone, the body can work the way it knows how, and people feel well.
So there's a lot of hope for what you all do, that, it gives people a sense of hope that no matter what the issue they have. A lot of women often come to me with, they've heard of acupuncture, for example, and the meridians that go up and down, and they've had a hysterectomy, which means that for some women, they used to be cut right across the body, which cut all the meridians of the body, and they go, oh my gosh, there's something wrong with me now because, I've had all the meridians cut, and how is that going to, get better because, this is so traumatizing and that kind of thing. So what do you tell people, about helping them to, I think a lot of people think balance has to do with perfection. And I want to get that notion out of people's heads that, we're not perfect. We never will be perfect in whatever form it takes, physically, emotionally, spiritually, mentally, whatever. There's always gaps, and we're here to learn. So how do you help a person who comes in, absolutely petrified that there's no hope, there's no way, and you're the last hope, that they're coming to after going to all these other modalities? And how do you help those kinds of people who are...
I think the relationship is probably one of the most important things. You have to feel comfortable with the person that you're going to, for no matter what their skill is that they're offering you. And if you don't feel comfortable in that relationship, you're probably not going to make very much progress. So I think that's really the foundation is, can I let it go around you? Can I trust you with what's going on with me, and that you will treat it as confidential and sacred, and you will do your best? And after that, then it's just up to your skill level. You know, how good are you at doing the work that you do? You know, as far as getting cut or, you know, cutting your meridians, you don't really do that. I mean, we can't dissect a meridian and say, oh, there's one under the microscope. It doesn't exist that way. Energetic medicine is far beyond what we really do understand, and you really can't damage it that much by doing surgery. So I just had surgery recently, and I'm fine. I cut my
that's good
whatever.
To know.
And yeah, it regenerates. So things regenerate. But however, I will say this. When I do lectures at colleges and universities, I always hit this point. If you have your navel pierced, and you're a young woman, and you've not had children yet, and you would like to have children, I would say get the piercing out. Remove it. Because there are 3 places in Chinese medicine where you are not to needle. The first one is the genitals, the other is the nipples, and the third is the navel. The navel sits in the middle of what's called the conception vessel, which runs vertically from the chin all the way down to the pubis. And it's a reservoir. It's considered to be one of the reservoir channels. And if you stop it right in the middle, right above the reproductive organs, you are stagnating the qi that goes down for conception. So
interesting.
Whenever I'm in an audience and I say that, I can always look out and see who's got their navel pierced. Because they're going, oh, or their friends going, hey. You know, but really, seriously, if you've got your navel pierced, you want to have a baby, take it out.
Okay. So Western medicine often talks of cures. So do we cure things here in terms of complementary medicine? Or, of course, we don't. But, I mean, do people have to keep coming back over and over again in order to be able to get healed? Or, you know, is there some point where we get to the... Is it some point where we get to the...
You cured me.
I guess it all depends on how we define cure.
Yeah. In chiropractic, we say we don't cure anything, that the body heals itself, which I think you guys are all saying the same thing. Yes, we're all on the same page with that. But, you know, the body heals itself, and I think all of us are supporting the body and doing what it knows how to do, but just, you know, removing the interferences, preventing it from being able to do it on its own. And yes, we don't necessarily get perfection, but our goal is optimization and allowing the body to remove as many obstacles as possible to allow the body to do what it needs to do to optimize function. And we do that. We're born to do that.
And for all of us, you can use us as to solve a problem, or you can use us as just for wellness. In Chinese medicine, the 4 times a year, it's traditional to come with the change of seasons and have what's called a seasonal tune-up, where you just get in tune with what's going on the earth. And I do that at the solstices and the equinox, and I see people sometimes just 4 times a year. I might have seen them earlier for a problem, and either I helped the problem, or I didn't help the problem, or somebody else helped the problem, whatever. But they come back 4 times a year and get their fall tune-up, and the winter solstice tune-up, and that kind of thing.
So we're talking about prevention here, which is something that, you know, we've stated earlier that, you know, Western medicine tends to work on what's present in the present moment, the emergency, heroic kinds of medicine. And a lot of what you all do may, in fact, be prevention, you know, before it gets to the point where you can't breathe and your body is over, or, you know, before you get to the point where you're crazy with all the things rolling around constantly in your mind, and do something or react to those kinds of things. What you're all talking about is doing things before it gets worse than it already is I think preventative medicine is really a new concept. People, I mean, we have insurance. We just did a whole program last week on insurance. And by the way, are you all covered by insurance? How's that?
It depends.
Okay.
Mostly in Virginia, mostly acupuncture is not covered. However, if you're a full-time UVA employee and you have Aetna, then it is covered.
Okay.
But that's the only one that's local.
Chiropractics?
Most policies cover chiropractic.
Okay.
So
Most policies will cover psychotherapy, some will cover neurofeedback, but we have a sliding scale, so we try to work with everybody that comes through the door.
Okay. Insurance?
Usually a flex spend account or health savings account can be utilized for a thermography scan, but major medical insurances and Medicare doesn't cover thermography.
Okay. So, we have to get to the point. It's not just people who are coming to you because you're the last resort and they've, exhausted everything else, but rather, to think of terms in prevention. I can come to you because I may have this issue or that issue, and, I'm in terms of my helping myself do things like, we tune up, we do car tune-ups, we change our oil. Those are all preventative strategies, and yet we don't think about it in terms of our own bodies or our own health.
Right.
being proactive.
Exactly.
Right.
I like to give the analogy, people say, well, how long do I have to continue to come in to get adjusted? It's
Right,
like, well,
yeah.
how long do you want to be healthy? It's like you go to the gym, you finally get in shape, and do you just stop going to the gym? No, you want to keep your health.
Right.
So, you want to be able to catch things early and keep yourself tuned up so that the stressors that do come into your life, you can handle them better. Or you don't want something to go so long that it becomes a crisis.
Exactly.
Yeah.
What were you brought something with you?
I did. When I talked about doing the breast screenings, we have the women put their hands on top of their head, and I do a few pictures left, right. 3 times out of 4, I see the lymphatic system is very congested. It's from years of deodorant use and sweat glands getting clogged and stress factors and all the different things. The heart pumps the blood, the lymph moves the blood, brings it back to the heart, but it gets stuck in these little junctures here underneath the arm. So 80% of all breast cancers happen in this area. So what I like to tell people is a little bit about skin brushing, and I talk about moving the lymph out of the lymphatic areas, moving it to the heart, doing a little dry brush technique. It is a 2-minute process you can do right before you shower, and it is one of the easiest things you can do for prevention to keep your lymphatics clean. So if mammograms can't get up there and the body is storing some fluid there, this is a perfect breeding ground for bad cells. They want a food supply and they need a warm nesting spot. So let's clean that area up and prevent. That's one of our biggest, preventative strategies for women, as we get to show them that their lymph is clean or it needs to be clean.
So when you say you look at somebody's underarm and see that it's stagnant, did you mean by the thermogram or with your eyes?
By the thermogram. By the thermogram. I'm sorry. By the thermogram.
No, I just wanted to know if it looks like something, that we can all...
Oh, visually, yeah. Well, you'll start to know if, the body, it starts to swell, there's an odor, there's, a few things that are going on. You can jump up and down on a trampoline. That's a wonderful thing for the lymphatic system, but this is a very easy technique that you can do at home in the privacy of your own home and prevent your, the chances of developing congestive in the lymphatics.
What does jumping up and down do?
It's a rebound. It's the bounce that moves the fluid in the blood.
Okay.
Very simply.
All right. So, we've been talking, we threw out another word that I don't think we've really explained as well, which is chi, energy, that kind of thing. For me, it's the thing that makes us alive versus a rock. That's the easiest explanation I can think of. So what is, very briefly, can anybody, you talked about the various discussions, the words that we use for
Every
chi.
culture has a term.
So it's
for
what
the
makes
life
us,
force.
it's the aliveness in us. It's
Right, what keeps us alive, what distinguishes us from that which is not alive.
So is that 21 gram thing, that supposedly that physician who did an experiment, who people died, and he weighed them right before they died, and after they died, they lost 21 grams, and he said that's the spirit that, goes out of the body or the chi or whatever. Is that what we're talking about here? Whatever
Everybody
that
weighs
thing is?
21 grams.
Our life force is 21 grams.
Wow.
So much for dead weight.
So much for dead weight, did you say? Okay. I just want to remind people who we have today. We're talking about alternative and complementary medicine. And to my left, we have Tammy Leiner, who's speaking to us about thermography. Next to her is Jody Forman, who's speaking about acupuncture, Jennifer Prax, who's a chiropractor, and Robin Bernhardt, who's a psychotherapist who uses EMDR and biofeedback. So we're getting close to the end of our time here. And just to wrap up, can you just summarize what we've been talking about here in any way that you'd like to, and let our audience know? They can all come to our website and find you and be able to talk to you through your own websites and through the email address you've given us or the phone number for them to call you. But do you have just, a 30-second summary that you can give us on just to wrap up for today?
I don't know about a summary. That's pretty
broad.
Yeah, exactly. But I think people would be interested in coming to our practice to rebalance, to release upsetting or disturbing memories, and to use we use our neurofeedback for both releasing distress and rebalancing the brain, and also for things like peak performance. I love to work with people who are interested in improving whatever it is that they do. For example, actors or musicians. So we do all of it.
Okay, Jennifer?
In chiropractic, we just want to keep the nervous system functioning at its peak or optimize it, and we're able to do that gently with children from pregnancy, newborns, all the way to seniors. We're helping.
If you want to feel great, want to feel wonderful, come have acupuncture.
Excellent. That's as simple as it gets. Tammy?
I guess I would say that you can always learn something new every day. And to learn something new about your body can give you the most power. And to know that you're doing your best, or that you can do better, or that you're doing great, is a powerful tool. And then you can go see these ladies.
There you go. And we will be having more programs on various kinds of alternative medicine in the future, alternative and complementary medicine in the future. You've been watching What Wise Women Want. I'm Daria Brezinski, your hostess, and this is Charlottesville's public access television, Comcast Channel 13. We're here every week discussing topics that we hope are of interest to you. Now, if you'd like to know what the future programs are, you can go to our website. You can find out who's going to be on the programs, and you can ask us questions there at www.whatwisewomenwant.com. And we look forward to you coming to visit us again, especially on Tuesday nights from 10 to 11 p.m. And thank you, ladies, very much. This is a very enlivening conversation and a very enlightening conversation as well. So please join us again next week. Thank you very much.